Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about substance use disorder. In this video, we'll first look at what substance use disorder is. We'll then look at the risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Substance use disorder is a mental health condition characterized by a problematic pattern of use of one or more substances that hinders a person's life. The substances commonly used include alcohol, caffeine, stimulants such as cocaine, cannabis such as marijuana, inhalants such as aerosol sprays or gases, hallucinogens such as LSD, sedatives, hypnotics, and anxiolytics such as sleeping pills, opioids such as heroin, nicotine and tobacco such as smoking cigarettes, which is the most common substance use disorder around the world. The severity of substance use disorder can range from mild to severe. A research study found that approximately 40.3 million Americans 12 or older had a substance use disorder in 2019. Risk factors. There are several risk factors that increase a person's chance of developing substance use disorder. Brain chemistry. Substances can send mass amounts of dopamine to the brain, creating a need for more pleasure from the substance. Over time, brain chemistry changes, causing a person to become desensitized to the effects of the substance. Genetics. Research has found that genetics account for 40% to 60% of a person's susceptibility of developing this disorder. Childhood trauma, such as abuse or neglect, or witnessing domestic violence. Having a mental health condition, including depression, anxiety, personality disorders, attention deficit hyperactivity disorder, panic disorder, or post-traumatic stress disorder. Another risk factor is access to substances. Having a family member or friend who uses substances can increase one's chance for substance use. Symptoms. There are several symptoms for substance use disorder, including using the substance more frequently than planned, having regular failed attempts to cut down or end the use of substance, spending a substantial amount of time to obtain, use, or recover from the substance, having a strong desire to use the substance, having work, home, or school impairments due to substance use, using substances despite the relationships problems caused, stopping work, school, or leisure activities due to substance use, continuing the use of substances despite knowing the potential damages, continuing the use of substances despite having a physical or psychological problem that could worsen because of the substances, developing a tolerance to the substance or needing more of the substance to produce the desired effect, experiencing withdrawal symptoms when not using the substances. Effects. Substance use disorder can affect people differently depending on the substance used. The complications can include loss of memory, personality changes, mood dysregulation, loss of nerve function, stroke, seizure, heart failure, liver failure, developing cancer, such as cancers associated with the mouth, liver, and colon, blood-borne viruses such as hepatitis B or hepatitis C, overdose, coma, and death. Treatment. The most common forms of treatment are detoxification, therapy, and medication. The first step of treatment is detoxification. To stop using the substance, treatment can be done in inpatient and outpatient settings. The next step of treatment is therapy. Cognitive behavioral therapy is a type of psychotherapy that can help people understand and change their unhelpful thoughts, feelings, and behaviors. Dialectical behavior therapy helps people develop skills to manage intense emotions, decrease self-destructive behaviors, and enhance relationships. Assertive community treatment provides care in a community-based setting and has an individualized approach. Therapeutic communities are a type of long-term residential treatment that can help people learn healthier values, attitudes, and behaviors. Contingency management offers rewards to encourage healthy behaviors. Lastly, a doctor can prescribe medication-assisted treatments for opioids, alcohol, and tobacco use. Coping strategies. A person with substance use disorder can use the following methods to cope: joining a support group, such as Alcoholics Anonymous or Narcotics Anonymous, balancing one's schedule to keep busy and avoid too much idle time, exercising regularly, practice relaxation to reduce stress, and seeking support from family and friends. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.